My name is Rebecca Sweeney. I work for the Wisconsin Cheesemakers Association. I do communications, education, and policy work for them. And today I'm pleased to welcome you to this informational webinar. Throughout the coronavirus pandemic, WCMA has been committed to bringing you information that will help keep your businesses running and help you protect your valued employees. And that's our focus today as well. We have a very packed schedule, so we're going to get right into it today. I'm going to share my screen and we'll get things started. So our webinar focus today is on new COVID-19 employer guidance from the state of Wisconsin and workplace consultations that are being offered by the state Laboratory of Hygiene. This is exciting and two new things that we're bringing you today information on. Our webinar agenda today, I welcomed you, and we're going to do a quick overview of our agenda, and then I'm going to introduce our presenters and I'll hand it right over to them. Today we're going to cover the current state of the public health emergency. Of course, here in Wisconsin, things have ticked upward, unfortunately, and we are seeing prevalence of outbreaks in all sectors and in all parts of the state. We're going to have an update from DHS on that. Then our DHS speaker will also be covering new COVID employer guidance, some broad guidelines that should help you make a plan for your business if you don't already have one, or to make some amendments that might be helpful in keeping your business up and running. The State Laboratory of Hygiene will be talking about those COVID-19 consultations, and then we'll very quickly cover other industry resources. I want to make sure that folks know that at the end of this, we're going to make sure we protect our time for a question and answer session, because there were a lot of questions submitted by you. We're going to cover as many of those as we possibly can. Now, I'm pleased to introduce our two key speakers today. First, we'll hear from Komi Moji, who is a COVID-19 Occupational Safety and Health Program epidemiologist with the Wisconsin Department of Health Services. And then we will hear from Kelly Rush, who is a COVID consultant with the Wisconsin State Laboratory of Hygiene. Both of these individuals are highly respected in their field, and they've been committed for the past 6 months to helping our state through this crisis. We're very pleased and honored to have them, and we know that you'll get a lot of good information from both of them. For now, I'll start with Komi. Please go ahead with your presentation, and thank you for joining us.
Thank you, Rebecca. Good afternoon, everybody. So I have two presentations, and the first one is COVID-19 in the workplace. So this presentation will touch 6 key points. The first 3 points are about case distribution across the nation, across Wisconsin, and in workplaces. I'm going to talk about risks for workplace transmission, risk mitigation strategies, and share some resources with you. This map shows the distribution of COVID-19 cases across the nation, and we can see that there are a lot of cases down the south, high populated area, and area with high industry concentration. I would like you to focus on the testing numbers in Wisconsin. So as of September 27th, we had 115,862 cases, including more than 2,000 case increase from the previous day, which is significantly high. So regardless of how we are charting this, like the case distribution, we are having more and more cases, and we have the highest count whatsoever in the month of September. Now, when it comes to outbreaks in workplace, what have we learned? We have researches and studies have shown that counties that have more than 20% of their employment in meatpacking industry have seen more outbreaks and more cases. And this is what this figure is showing, and is consistent over time. Breaking down outbreaks by industry sector, and this is Utah example. The top 3 industry sectors are manufacturing, wholesale trade, and construction. And what they have in common is indoor environment and close contact. Now, in Wisconsin, we do not have this data as of today, but our epidemiologists are working hardly to provide information to the public. Being close contact is a high risk for workplace transmission, and we define close contact as individuals being less than 6 feet apart for more than 15 minutes. Now, there are other risk factors such as occupancy, ventilation, and activity. And I can say if you have a high occupancy rate, it's a high risk. A poorly ventilated indoor space is also a high risk, as well as shouting versus speaking. Breaking down COVID-19 public health investigations by settings in Wisconsin, we have seen that workplaces that are not healthcare related are the leading places of outbreak and case distribution. Next slide, please. I would like to draw your attention to risk mitigation strategies and really focus on the figure on the right-hand side. And this figure is showing 4 situations, 1 risky situation and 3 different ways to remedy that. So the first is workers working closely less than 6 feet apart and they are facing each other. That one is definitely a risky situation that will spread COVID-19 significantly. Now, one way to fix it is to allow more than 6 feet between workers and avoid them facing each other. That's the first one. The other 2 ways are to separate them from each other. Of course, they will be using face covering and they will be having some barrier between each other and 6 feet apart. And the last one is the best kind of situation or disposition we could have to protect workers and workplace. Also, we have to think about training and education, and I'm going to talk about training in the education in the next presentation. Also, it's very important to think policies to reduce the risk of presenteeism through flexible work policies and paid sick leave.
This is a conceptual visualization of how SARS-CoV might disperse throughout a room by a recirculating fan. It assumes there is an aerosolization event that emits viral droplets and then aerosols, fine aerosols. These get caught up in the airflow. This assumes dry indoor air, no filtration, and minimal outside air. You can see that the hypothetical attachment in this scenario is high. The number of occupants that become infected is noted with red profiles.
Thank you. So this is a visual representation of a poorly ventilated workspace where somebody just by coughing has spread out COVID-19 virus across the room, which contaminated other workers. Next slide, please. It's at the bottom left-hand side. Thank you. So we have some resources that we are bringing to employers to support their procedure and everything they are doing to keep businesses open and safe. The first one is the WEDC. We have on the WEDC the Reopen Guideline. It's a document wrote by DHS, but available on the WEDC website. And it provides information to employers to keep to be ready and to keep their place ready during this pandemic. The second is the employer guidance, which will come very soon. I'm speaking about days. It's already on the way out. And as soon as it's posted, I'll share the link with Rebecca and I think she will really share the link with you. We have really friendly, user-friendly information in there. The second resource is WISCON, and I'm happy Kelly is here. We have NIOC and Family Health La Clinica. Thank you. Okay, so going on my second presentation. So this is, I think, a very good overview of the employee guidance that will be coming out very, very soon. And the employee guidance is touching 5 key points that are very necessary questions that employers has asked or posed us during our investigation. The first one is, how do I keep my business open and keep workers and customers safe? One of my workers has COVID-19, what do I do now? How do I work with local and tribal health department to keep my business open? What's the most effective way to use COVID-19 testing in my workplace? And when can a worker return to work? Now let's talk about how do I keep my business safe, open and customers safe. One more time, please. Thank you. Two key points are very important in keeping businesses open and workers safe. The first one is to make a COVID-19 plan now. And for that, we have resources available on the WEDC website that provide general guidelines and sector-specific recommendations. And those informations are coming from DHS. We have WISCON. I'm happy Karen is here to talk about the emergency preparedness template that they use with businesses to customize this plan to meet their needs. It's very, very important to work with local health department and establish a consistent, a very reliable business relationship with them. And we have provided checklists in our employer guidance to facilitate the monitoring of the process. The second is to review relevant policies such as paid leave, paid time off, and no-fault attendance. How well is my business able to keep employer and visitors safe? The first one is to get a workplace risk assessment, and Kelly is here and she's going to elaborate more on that, so I'll move to the next. The second is worker training. It's very important to have workers trained about health topic and safety, and the training has to go beyond handing flyers and fact sheet and email to workers, because we have seen that businesses who just hand out flyers have been hit severely by COVID-19, because that way of educating workers doesn't work. You have to make sure they understand the message and they really practice what you taught them. Policy and procedures and more information on workers training is available on WEDC and OSHA website. The last one is worker symptom screening, which has to go beyond just temperature check. So the screening has to include all COVID-19 symptoms, and it has to be done at the beginning of the shift. So, and every day. We have provided screening tools in the employer guidance to help employers conducting healthy and safe screening. Next, thank you. One of my workers has COVID-19. What do I do now? The first thing to do is to close off area used by the worker. And clean and disinfect and proper procedures are available on the WEDC general guidance. The third is to call the local and tribal health department to report the case or cases. And that's very important. And we are stressing on the collaboration between employers and local health department. And finally, work with the local health department to share information and make a plan to keep your business safe, the workers safe, and keep the business running. We have some tool, some checklists and spreadsheet to facilitate the process. in the employer guidance. How do I work with the local health department to keep my business open? So as an employer, if you are aware of one worker who is COVID-19 positive, you should let the health department know as soon as possible. Now, if you have 2 or more workers positive for COVID-19 within 28 days, this is considered outbreak by definition. And the first thing to do is to call or let the health department know as soon as possible so they can open an outbreak investigation. Now, I would like really to clarify this. The outbreak investigation is now designed to assign blame on employers. The goal is to stop the spread of COVID-19. So regardless whether or not it's workplace related or not, it doesn't change how the investigation is going to be conducted. And again, the goal is not to determine if this spread of COVID-19 is workplace related or not. We want to stop the progress or the spread of the disease. Now, which brings us to 2 very important concepts. The first one is isolation. Isolation is for people who are positive for COVID-19. And quarantine is for close contact who are healthy. Next slide, please. How do I work with the local health department to keep my business open? Contact tracing and case investigation are the responsibility of local health departments. However, employers can start collecting information about workers, and we really encourage them to share close contact tracing information with local health department because it has to be done collaboratively. We have a checklist and spreadsheet that are also available to local health department, which will really help in sharing information. And since these are health information, these should be shared in a very secure or safe way to avoid divulging personal health information to the public. Local health department in this collaboration will determine the return to work date for employees under isolation and quarantine. What's the most effective way to use COVID-19 testing in my workplace? Testing can be done by a healthcare provider or community testing center. PCR and antigen testing are just a snapshot of one point in time. So if someone tests negative for COVID-19, it doesn't mean the person is COVID-free. It just means that specific date and time you are negative. Anything else, we don't know. Local health department will determine the best testing strategy based on where in your business the case, the contamination occurs, and how many people are involved in this spread or in this outbreak. And there are a lot of testing strategies that the health department will determine that. Another option that is available is serial testing, which is a repeated testing of all exposed workers. And if you need more information about it, we really recommend you talk to local health department or the state for guidance. When can a worker return to work? We have 2 situations. If someone is in isolation, which means the person tests positive for COVID-19, the person will return to work after 10 days of isolation and 1 day symptom-free, which is 11 days total. If the person is a close contact and is in quarantine and has stayed healthy during the 14 days, the person will return to work after 14 days. The return to work should not be based on any test. It's only based on symptoms and days. So we are no longer using any test to determine if a person is ready to go back to work. Any exceptions must be approved by state or local health department. And CDC does not recommend any testing within 90 days from symptom onset for people who test positive. Next slide, please. So this is my conclusion. And when can a worker return to work? This infographic captures everything I just talked about, from close contact, outbreak definition, isolation, quarantine, and return to work. So I'm going to walk you through this infographic very quickly. So we have Comey, Barb, and Colin. They work closely together. And 2 days later, Barb she started showing symptoms and she got tested. And the best practice is to start isolation the same day. So she was later confirmed positive, which means she has to continue isolation for total 10 days. And she did improve, and her symptoms improved significantly within 10 days. So she completed her isolation and had 1 more day symptom-free, and she returns to work without needing any test. How about the 2 guys, Colin and Comey? So they started their quarantine after being notified by the health department, and they will be monitoring their symptoms every day, twice daily. And in the process, 5 days later, Comey started to show symptoms of COVID-19. He called the health department, get tested, and the department, now Comey has to transition from quarantine into isolation, and 10 days of isolation, 1 day symptom-free. So if we put it together, Comey has 5 days of quarantine already, 10 days of isolation, 1 day symptom-free. Comey will return to work after 16 days, and he did not need any tests also before returning to work. Colin did not have any complication during his quarantine, and Colin will return to work after 14 days of quarantine without doing any test before returning to work. So those are messages, key messages I wanted to convey this afternoon. And because this business has 2 cases within 28 days, this is called outbreak. And the local health department will investigate to see if there are more cases in the business. Next slide, please. So here are some resources we are bringing into you this afternoon. We have the WDC website. We have local health department contact information, and we have the DHS website. Thank you.
Thank you so much. I think that was a really helpful and informative presentation. And we're very fortunate, I think, to be getting sort of a preview of this employer guidance, which will be out soon. And yes, we will be sharing that broadly with our membership, because some of those worksheets, the charts that people can use to create their own plan or update their plan will be really valuable. We had a couple of quick questions that I just want to address now before we even move on to the next segment. One, I believe someone asked, will we have access to this presentation and the recording? Yes, of course, we'll be posting this after we're done today. 2 was about that flow chart that you presented, Comey. What if an employee is sick and tests negative? How long do you recommend they isolate? So before we even move on, could you address that sort of offshoot scenario?
Sure. The first thing I will say for this question is there is no specific sign and symptoms of COVID-19. So if the person does the right test, which is the PCR test, and test negative, it means it's not a COVID infection, and the healthcare provider should give more insight about it.
All right. Now we're going to transition over to Kelly Rush from the Wisconsin State Laboratory of Hygiene, who's going to talk us through a very new service that they're offering, free, confidential, and very valuable workplace consultations.
Perfect. Thanks so much, Rebecca. So just a little backstory about our consultation. So we are a team of 8 occupational health specialists with over a combined 50 years of experience. Our team really believes that Wisconsin businesses deserve a clear support system. They deserve direct advice in their efforts to protect their staff and, more importantly, their business during this really trying and difficult time. So that is why our team is working to reach out to businesses across the state of Wisconsin in hopes of helping them there. As far as our COVID consultation, could you back up really quick, Rebecca?
Thank you.
Thanks so much. So about kind of the free services, so we do a few different things. Again, this is absolutely a free service, and I know you are probably thinking, what's the catch? And there isn't a catch. We are going to encourage you that if we identify things as far as PPE or engineering or administrative controls, that you're going to take the steps necessary to fix those. And of course, that may come with a cost, but in no way can we enforce if you actually make those changes. It will be up to each business to determine what is most cost effective for their individual organization. And we can help you along that way. I know that putting in all of these controls can be really challenging and really difficult, and our staff can actually help you identify what would be most important to implement and in what ways you should focus on those practices first. We can help figure out what would be most cost effective and provide the best mitigation strategy in that workplace. We also can assist with helping develop a COVID-19 exposure prevention preparedness and response plan if your business currently doesn't already have one. I know a lot of information came out really fast, whether it was from the WEDC website or CDC, and a lot of these websites say do one thing, create a plan, right? But they don't actually go into the steps of what that plan should include or how to write that plan, or what things a business should really consider. And that's where we come into play. We've actually created a template that businesses can use to make sure they're hitting all of those main points. And if you develop questions along the way, we're there to help you answer them. And if we don't know the answers, we're gonna find you the best answer that we can and get you the best scientific evidence that supports that in that process. Additionally, we're gonna help conduct a job hazard analysis or workplace risk assessment if that's what's needed in the workplace as well. We can also provide training to both employers and employees if you're looking for someone to provide assistance with that too. Next slide. There are a few different ways to request our services. The easiest one is just to complete the form online, which is under the COVID-19 Consulting Service Request website or main page, or you can also email us with direct questions if you're not sure consultation's for you. If you don't want a full-fledged consultation, but you just have really specific questions that you're hoping we can address, feel free to shoot us an email. Next slide. And here you're going to see that COVID consulting webpage that's on the Wisconsin State Laboratory of Hygiene's website. There you'll see a little bit of information about what we can offer, and the links with the arrows pointing is going to be where you can click for the form in order to fill it out and request these consultation services. So what to expect? So first we're going to meet with you over the phone or potentially a Zoom call, whatever is most comfortable for you as a business, and determine what type of services you're actually looking for. I know a lot of businesses already have plans in place. Maybe they're just looking to identify a new process, or maybe something is out of stock and you're trying to implement an engineering control for spacing in the workplace or manufacturing, for example. You can give us a call and say, you know, this is what the recommendations were, but there's nothing in stock. What is something else we should consider, or what else should we do? And we're going to be happy to help you kind of figure that answer out. We're also going to sit there and try to determine if you already have a plan in place, are there any deficiencies in the plan? Is there something you haven't considered yet, or is something missing from that plan? and we'll work with you to create the best possible strategies to make sure that your employees are safe and that your business can stay open and running. Additionally, we're happy to go through some of that industry-specific guidance that's out there. I know that it can be overwhelming. There is so many links, right? You can go to the WCMA website and it'll say, check out the CDC. The CDC will say, check out this website. And so it can take a lot for a business to sit there and try to comb through all the information, but we're really a resource that can sit there and help you understand what is more important for your business and what you really need to focus on. We'll also help determine if you need to go a step further and do that virtual or on-site consultation. Next slide. So if we decide to move forward and do that virtual or on-site consultation, the first thing we're going to do is send out a service term agreement that just spells out what we're going to do in the process and what you can expect from our services, and also what our expectations are of you as in a business that we'll be working with. After we do that first service term agreement, you sign it, you say, looks good, come on in, whether it's virtually or in person. We are going to be using this idea of a COVID report card, if you will. And this COVID report card is really going to focus on 7 different areas that we're going to be scoring for a business. One of those is going to be hazard anticipation and detection. So are there health and safety inspections being performed in coordination for identifying different COVID hazards in the workplace? Are your SDSs up to date for those new chemicals you brought in that the EPA recommended? We're going to focus on hazard prevention and control. Are there engineering controls in place? And are workers wearing sufficient PPE or personal protective equipment? Are they wearing face masks? Are they hanging below their nose? Are they, taking it off to take sips in front of all their friends? We don't know, but we're going to identify that. We're going to work to also identify different planning and evaluation strategies that you're currently doing. What does absenteeism look like in the workplace? Have you been proactive with working with local public health? Additionally, we're going to talk about administration and supervision. Have COVID responsibilities been assigned? And are those individuals who are assigned those responsibilities, have they received the proper training? Do they have the knowledge and support of the business behind them to implement certain things? Next, we're going to talk about safety and training. Have your employees been trained? Do they understand the importance of not only protecting themselves in the workplace, but when they go home so that they can return the next day to work? But also, are we taking care of their families and making sure they understand just how serious this virus is? And lastly, we're going to talk about employee participation. Are their concerns being heard? And is there a way that you can potentially have a team of employees give you feedback about how they're hoping COVID is handled in the workplace? After we go through that report card, we score those things for you. We're going to identify and make some suggestions on maybe where things should be changed or where improvements could be made. We like to believe that every business is already being proactive in doing this, but if there is some shortfalls, we're there along the way to help provide recommendations for improvements. Next slide. Oops, I think we passed one. Okay, perfect. Oh, nope, that was it. So those things are really going to be what walks you through kind of our services. And I hope you just are aware that we know that this is a really hard and difficult time. We know that you are trying to imagine every strategy or every situation, and that can be really hard, but there are people here who are absolutely here to help you. Kind of as Comey alluded to, we are a service that can walk you through some of those tougher pieces, and even if you just want to give us a call, know that we're always going to respond.
I'm so excited about the service that you're going to be providing, and I think that this particular industry is going to take advantage of that. So be ready for some applications coming your way. I know that this service, along with the employer guidance, have been months in the making. And now that this service is available, we want to take advantage of that. So there's been a lot of information shared in the last 35 minutes, and we have a lot of questions that came in from our members, and Comey and Kelly have graciously agreed to field them. So we're gonna throw some at you now, and we're gonna start with the workplace guidance questions. Some of these questions are similar, so I wanna note to everybody on the webinar that there's a chance that we combined your questions because they were similar to another person's question as well. So we want to make sure we make the most of our time. The first question is for you, Comey. My plant has employees from 2 different counties, and their public health officers have provided different directions about the length of quarantine following a close contact. Whose advice do I follow?
Yeah, this is a very good question. And when you have outbreak involving individuals living in different counties, we call that multi-jurisdictional outbreak. And what is recommended is to get in touch with the local health department where the facility is at. So that's the recommendation. The leading health department is the one that hosts the facility. So if the facility is in a county A, and workers are in county B and C, D, and A, you just call the local health department where the facility in question is, and he will clarify the situation. Now, if you are still confused or things are still not clear enough, you could reach out to the state. And I'm going to share some, there you go. I'm sharing with you 2 addresses or 2 mailboxes where you can send questions, and our team and other divisions will take care of it.
Folks, that information's in the chat. And what I'm going to do after this webinar is we're also going to send a follow-up email to all of you with some of the most important links that were shared today. So that's a very clear answer. The answer is, if you have employees from multiple counties, you need to follow the advice of the county public health officer in which your facility resides. Thank you, Comey. That helps a lot. This is a similar question. Some counties in which our employees work say that the food industry is not considered essential in Wisconsin. In consequence, they believe that if a coworker tests positive, then their close contacts have to quarantine for 2 weeks. Our company follows what we take to be CDC guidance, which allows close contacts to go for a test and continue to work while they wait for results. So there's a lot going on there. Counties are saying different things about whether plants are essential, dairy processing plants are essential or non-essential. And that means different things for how employees might be allowed to continue to work. So Comey, can you speak to that issue?
Yes, so what I'm seeing in this question, I'm seeing 2 issues. One is essential businesses, and the second is if somebody who is close contact can return to work sooner. So let me talk about the second one first. So yes, it's possible to have somebody who is close contact, not a case, just a close contact, to return to work sooner than 14 days. And that's what we put in the serial testing. And the first thing I would like to say is to collaborate with the local health department. I'm going to talk about it, but the first thing is to get information from the local health department for practical and practical guidance. Now, what is serial testing? Someone who is close contact and who is supposed to do 14 days can have PCR testing. We have different kind of testing, but the one in serial testing is PCR. So you have PCR every 3 days, and you could return to work if you have 2 negative results, 2 consecutive negative PCR results. You return to work, you have your face covering, you have other precautions, 6 feet apart from each other, and you keep doing the testing every 3 days until the 14 days are over. So yes, it's possible to return to work sooner if you have key workers, but they have to do serial testing in accordance with the local health department, which is testing every 3 days, and return to work if you have 2 consecutive negative results, and keep testing until the 14 days are over.
I just want to note that some counties are familiar with serial testing and other counties are less so. So if you're trying to pursue a serial testing strategy to get a return to work, ask your local public health if they're familiar with serial testing. And if they're not, then it's time to make that call to the state and to try to loop them in so that you're doing it right. Serial testing does not mean going for one test, making sure they have a negative, and then having them come back to work with a mask on. It means multiple tests throughout the 14-day period. So Comey, do you want to touch on that other topic too of what is essential, knowing that this is a sensitive topic for some of us?
Yes, essential is a sensitive topic. Actually, what I can say is, Wisconsin Department of Health Services has its own, the state has its own definition of essential services or essential businesses, and it's not a list, and
it's not the same list as the Homeland Security list.
I don't want to misquote the definition, and I can send you the link to that, but it's, again, it has to be determined by local health department. That's the key point. It has to be evaluated on case-by-case basis. We don't have a list, a predetermined list of businesses that are essential as we are seeing in other states, but we give the possibility of local health department to assess with the employer if it's a critical business or if some people or some employees are very critical in the functioning, or if somebody is in quarantine will threaten the public health safety of the community or the business. So local health department, again, are put in line.
And folks, give us a call too if you're encountering that issue. That's also something that your trade association can help you with. All right. Is there any way, we've kind of touched on this, so maybe we don't need to spend a lot of time on it, but is there any way for me to safely expedite an employee's return to work following a COVID-19 close contact?
Sure. Short answer, serial testing.
Right. There we go. Just underline that. What effect does mask wearing have on the definition of close contact? Without masks, we understand the definition is 6 feet for more than 15 minutes per day. But what about when everyone wears masks, washes their hands, and cleans the surfaces? Does that change anything, Comey?
It doesn't. Unfortunately, if we are talking about mask as the one that is commonly recommended or face covering, it doesn't. It doesn't. Before you get to the exclusion or some exemption to this, it has to be specific mask, and the business should have a respiratory protection program and have their face covering pass the fit test. And in that case, again, you have to assess it on case by case with the local health department. But if you want a short answer of this question specifically, is no.
We still need to wear the masks, though. The masks must also be worn because it does make a difference in the number of cases you're going to end up with. All right, I think we have one more question on the employer guidance. What's the food safety risk of the virus living on any packaging? Am I going to pick this up from grabbing my yogurt cup?
This is a complex question because there is no absolute answer when it comes to infection control or immunology and all those scientific domain content. However, in a normal situation, when somebody who is positive, I'm not going to say something gross, but if in a normal situation, normal commercial situation, the likelihood is very low. I'm not saying zero, but it's very low to transmit. So hygiene is the key point. Yes, it's very low. Not zero, not null, but it's very low.
And we have that from the U.S. Food and Drug Administration, as well as the World Health Organization and the Centers for Disease Control and Prevention as well. So folks, I think that there's a lot of authorities telling us that this is a very low risk situation. It would have to be something sort of extreme where somebody would pick this up. So we're already making things very safe in our plants and sanitary. So that's the key there. We do have one more. We're considering installing plexiglass barriers in the plant to offer more separation between workspaces. Are there any financial or consultative resources to help me? Perhaps this is a good bridge into our questions for Kelly too.
I agree.
Okay.
And okay, let me start answering it, and I think I'll let Kelly finish it. But I think it's always important and necessary. Otherwise, it's super helpful to have more barrier between workers in order to strengthen the protection we are offering them. So I'll let Kelly take the lead on this.
As far as financial resources, I am not sure of a ton out there. I know that at one point there were some small business loans available to help companies, but I would look more for state-specific guidance on some of those resources or where financial help could be. I believe the WEDC website actually lists some of those resources, so I would check there if you have questions about the financial piece. But as far as consultative resources, we are absolutely here to help you. I know it has actually been really difficult for businesses to get things like plexiglass in or be able to find similar materials in order to create those barriers between employees. But our job is to really help you with that and help identify other strategies in order for you to be able to protect your employees to the best way that we possibly can. So that's definitely something you can reach out to us for. We can help you identify this particular situation, what controls might be best, and if a particular thing like plexiglass is out of stock, we'll help you identify the next best thing.
We'll jump back to employer guidance. We've gotten mixed messages about the best type of face mask. What kind do you believe is most effective? Comey, do you have a favorite face mask?
I do not. Okay, so this is a very complex question, even though it's very simple. And we have in the audience, we have Barbara Grajowski and Colin Morris. I would like to loop them in this question.
Sure.
We've got some other
It's
experts
possible.
here from DHS.
Yeah.
Waiting in the wings. Barb?
Oh, I've been, I think Comey's done a great job. Haven't had to add much here. I just would like to say that, yeah, in a perfect world, the type of respiratory protection, which is a step up from a face mask that you'd want to have, is an N95. But to do that, generally speaking, you have to have a respiratory protection program and fit testing for your employees. There may be industries where N95s or other respirators are used, were used before the pandemic, will be used after the pandemic. There are respiratory hazards in certain workplaces where you would need this. As you probably all have heard out in the popular press, there's been a shortage of this particular type of respirator, and it's been triaged. In other words, the people and the industries, the businesses that need it the most, healthcare industries obviously, are the ones who are getting the N95s. That said, there's a very solid and good body of evidence that shows that simple face coverings, and there are many different types of face coverings. If a face is covered, you are slowing, or not completely stopping, but slowing the transmission of aerosol, big aerosol droplets from a person. And there was a really nice small report several weeks back, a beauty salon, where they had they had a policy, everybody had to wear a mask. They didn't specify what type of mask, and there are different types out there. Comfort is one thing, and you know, these are considerations. But everyone in that salon had a mask on, including the stylist. Turned out one of the stylists was positive for COVID-19. They looked at all the people who had come, all the clients who had come to the salon, they followed them. Not a single person contracted COVID-19 from that stylist. Now, you know, that's not always going to happen in all cases, but the story remains that these masks, simple as they may be, do a lot to prevent the big elephant in the room of transmission, which is droplet spread, from happening. And so you may have employees that like one type of mask rather than another, and giving a person some decision latitude over that, if you can do it, is useful. I know another place in town here where they're supplying branded masks for their employees, you know, and there's a lot of variability, but getting employees to wear a mask and wear it over their nose and mouth when they're in close contact with others really is the bottom line for keeping the risk of COVID-19 low in your workplace. That's
great. Wonderful answer. Barbara, thank you so much. We are going to switch over to you, Kelly. You're in the hot seat. And this is the biggest question we've had, the most frequent question we've had since we shared the news that this service was being launched. Who has access to those report cards, the COVID-19 consultation report cards? Can reporters request data through the open records law? Are you going to share those reports with county public health officials? Can my employees see that information? Who gets to see those report cards or any other information that, that you're working on with a business?
You know, Rebecca, that is a wonderful question. So who has access to the consultation reports really depends on what the business chooses to do. So our team does offer a non-disclosure agreement, or NDA, which we can't, of course, say is ironclad, but we like to believe that it's pretty close, and it will definitely make it a lot harder for individuals like reporters to get access to that. The attorneys at UW-Madison did draw up that NDA, and it is there to protect not only you, but your business. A business that we're working with is also open to have their attorneys look that over before even making a decision to work with us. We found that a lot of businesses feel more comfortable having that in place and being able to use their own discretion when choosing who has access to some of this information. As far as providing the report to local health officials, that is not something we will be doing, especially with that NDA in place. We, of course, want businesses to be open, honest, and transparent, though, with local public health. Even if that means just letting them know you're working with us. It shows that your business is being proactive and taking those steps necessary to protect your company and your employees. And we also believe that working with us shows that good faith effort. However, it is ultimately up to the business, again, if they choose to share that report, if they want to let that local health department know they're working with us, that is all on them. So after we have that NDA in place, that's when we begin setting up those consultation visits with that business. We'll go through the report card. And after that report card is finished, we'll send an end of visit summary with some additional information about where changes can be made. At that point, when we're done with that, the business can decide if they, even if they have an NDA, if they want to share that information with local public health, they can absolutely do so, but we will not be sharing any of that information. That is all on the business.
That's wonderful, and I think reassuring for a lot of folks who are questioning whether this is right for them. You can always have your attorney take a look at it and review whether it's the right fit for you. But clearly, this is an effort that's meant to support a business and not do anything that might hurt them. What information will you want prepared before an on-site or a virtual visit? Kelly, what would be the best case scenario for you?
Yeah, so prior to that consultation visit, we really like to have a phone call with the business to just kind of hear what's going on. What has happened so far? Have you had COVID in the workplace? Have you been a lucky business who hasn't experienced that yet but really wants to get going on it? Do you already have a COVID plan in place? And if you have a COVID plan in place, we're going to ask you to share it with us before we do that consultation visit. It will allow us to identify different deficiencies in your program, and we'll be able to start making suggestions right away on how to make improvements, which can shorten the time it takes us to better protect those employees. After we kind of go through that, we're going to want to, again, schedule that consultation visit, or even just a phone call if you're not looking for full-fledged consultation. We're going to ask you, again, kind of what's been going on, what PPE you're using in the workplace. You know, have you considered doing a job hazard analysis? And if you've already performed one, what did you find? Or do you have questions about that? And that's really kind of the things we're going to want to know is what is the current experience when we're coming into this situation or this workplace so that we're best prepared to serve them. So just being really transparent with us and honest is the best thing you can do. Again, we have no teeth in the game is the nicest way to put it. We're not local public health, we're not OSHA, we're not the FDA, we're not the USDA, we're not any of these people. We can't implement citations if you don't listen to us or if you don't like what we say. We're really just here to bridge that gap and be this good faith effort to help your business be successful and to help protect your employees.
Molly, how are others handling employee expectations out of work? This is something that we're hearing about a lot, that while there are PPE in use and social distancing observed in workplaces, people are contracting COVID-19 out at the bar or at a wedding or a party. Do employers have rights? And if so, what are they?
You know, I think the most important thing is to be teaching employees good practices, not only in the workplace, but practices that they can take home and to share with their families. Because at the end of the day, if an employee gets sick at work, there is a chance they're going to bring that home to their family and friends and that they could get sick and now they're out of work. And, you know, I think as people in general, we want to make sure to take care of the health and safety of our friends, coworkers, and loved ones. So it's not just about having employers teach employees what they need to be doing at work, but also what they need to be doing at home. And if that means sitting out that 200-person wedding, you know, that might be a good option. But it's really going to be making those suggestions on how to better protect their employees, not only when they're at work, but outside of work as well. And I think talking more about things like good hand washing practices, wearing a mask, making sure, you know, when you're out and about, the first thing you do is when you get in your car, use hand sanitizer, wash your hands when you can, make sure you're not touching your eyes, nose, or mouth directly after taking off your mask. And when you are taking off your mask, again, make sure you're hand washing. I think the other important thing to know is that we should also be teaching these employees how to properly wash masks. And I know that some people haven't even thought about that. Like, what do you mean wash your mask? But you know, they get dirty too, and that's another way of transmission is just not cleaning those frequently enough and making sure you're cleaning them to the level that the CDC is recommending. But again, these are all things that we can provide as training to businesses. So if they're interested in even just having us provide training to their employees, that's something we can definitely help them with.
Wonderful. That training is, I think, much needed. Not really necessarily for what's happening in the workplace, because there's some hard and fast rules in place now in most workplaces, but just making sure everyone continues those good practices after their workday is done. Probably could be a whole nother webinar, but we'll have to talk about that. I'm going to quickly breeze over some other industry resources, but I know 2 o'clock's hit. There have been a couple of other quick questions that have come in, and we'll work on getting you some answers to those as time goes by. I just want you to know that, again, a lot of the information that we share with you through those twice weekly member newsletters and bulletins comes from the CDC. This is always a good authority for you to check. The OSHA guidance is available there. We do have some standard operating procedures available on our website for when you have a COVID positive worker and when that COVID positive worker returns to work. There are multiple websites that are industry specific that focus on COVID-19 now that are updated daily. And that includes the Wisconsin Cheesemakers Association website. That's wischeesemakers.org. And I just want to close by sincerely thanking our presenters, Comey and Kelly, who themselves represent huge teams of people who are working day and night to try to curb the spike that's occurring right now in Wisconsin of COVID-19. They put in long hours. I get these emails from them at 10 o'clock at night. So just like you all are working hard in your plants to keep things up and running, to keep your employees safe, these partners that we have at the state level are doing that same important work. So we're going to make good use of both of you as resources and good use of your agencies and teams. We just want to thank you so very much. And one final reminder, we will be sending out a follow-up email to everyone on this call today. And you'll also be seeing some of those materials in upcoming newsletters. Thank you so much.
Thank you.
Thank you so much.